Welcome to the fourth video in our module on biopsychology. This is Kristen Lazarova, and in this video, you'll be learning about the brain. You'll learn that the brain is divided into two hemispheres, and you'll learn about how these hemispheres communicate. You'll also learn what it's like for people who've had split brain surgery. In other words, what happens when the ability to have these two hemispheres communicate is surgically altered. This will give you a chance to think about the importance of the communication taking place between the two hemispheres. You're also going to be learning about the lobes of the brain. You'll learn that the outer portion of the brain, the wrinkled part that most of us think about when we think about the brain, that makes up about 85% of our brain, is comprised of four main lobes or regions in each hemisphere. You'll also learn about what each of these lobes' functions are, and as you do, you'll be learning about some very famous case studies that have provided insight into the areas of the brain and their functions. We'll then move inside of the brain, and we'll look at the limbic system, which has the main functions of emotion, memory, and motivation. We'll then look at the midbrain and the hindbrain and some of the structures in these areas. Before we get started, let's think a little bit about the complexity of the human brain. First, it weighs about 3.3 pounds or 1.5 kilograms on average. So the average brain makes up about 2% of a human's body weight, and it contains about 86 billion nerve cells. Overall brain size, though, doesn't correlate with level of intelligence. So for instance, the brain of a sperm whale is more than 5 times heavier than the human brain, but humans are considered to be a higher intelligence or have higher intelligence than sperm whales. The more accurate measure of how intelligent an animal may be is the ratio between the size of the brain and body size. So among humans, brain size doesn't indicate how smart someone is, though. Some geniuses in their field have smaller than average brains, while others have larger than average. For example, in one study, when one neuroscientist compared the brains of two highly acclaimed writers, what he found was that one of their brains weighed in at 2,021 grams. The other writer's brain weighed in at 1,017 grams, so very different weights. Humans have a very high brain weight to body ratio, but so do other animals. In other words, the amount of brain weight in proportion to body size is much smaller. This is actually very similar, like I said, to other animals. The reasons, though, for humans' intelligence in part is due to neurons and folds. So if you look at the image here on the screen, you're going to see that the brain has many folds as we look specifically at the lower image and we look at the cerebral cortex. And when we look at this, we can see that, and we can imagine that because of these folds, that this would allow for more surface area. This would also allow for more neurons, and humans have more neurons per unit of volume than other animals. And the only way that they do this is because of the brain's folds on the outer layer, the cerebral cortex. In this module video, you'll also learn about the frontal lobes of the brain. Humans also have the largest frontal lobes of any animal. The frontal lobes are associated with higher level functions like self-control, planning, logic, and abstract thought. Now, I want you to keep in mind as you learn about the brain that the frontal lobe and the prefrontal cortex that you'll learn about is the last part of the brain to develop. Our brains are fully developed by the time we're about 25 years of age. So in other words, the parts of our brain that are important for those higher level functions like self-control, planning, logic, and abstract thought, they're the last to develop. So let's get started on this module. Let's now take a look at the brain. So in this image, you see the outer portion of the brain. You see what's called the cerebral cortex, and the brain is primarily comprised of the cerebral cortex. It comprises about 85% of our brain. The brain is comprised of two hemispheres, a right hemisphere and a left hemisphere. The right hemisphere controls the left side of the body. The left hemisphere controls the right side of the body. We'll be talking about lots of the different functions that each structure or many of the structures of the brain has. Let's start with the corpus callosum. The corpus callosum is a band of nerve fibers that is important for communication between the right and left hemispheres. And you can see this in the image on the right-hand side. You can see that corpus callosum. So there's actually a condition, it's called split brain syndrome. And this is characterized by a cluster of abnormalities that arise from a partial or a complete severing or lesioning of the corpus callosum. So can you imagine what life would be like for you if the right and left hemispheres were unable to communicate with each other? So let's first start with, what are the tasks of each hemisphere? Well, I mentioned that the right hemisphere controls the left side of the body, the left controls the right side of the body, but there's a lot more to this story than that. So it's thought that, although it's not fully understood whether the processing of specific tasks is dependent on both hemispheres of the brain, the two hemispheres appear to each have some control over certain tasks. So for example, it's generally thought that the left hemisphere is responsible for analytical tasks. And so that would include things like calculating and reading. And for many people, it's also the dominant center for speech and language. But it's also thought that the right hemisphere does have some involvement in language as well. So the left hemisphere is thought to be responsible for analytical tasks, and then the right hemisphere seems to be responsible for dealing with spatial tasks like navigating a maze or reading a map. It seems to be more involved in those activities than the left hemisphere. But these two hemispheres routinely communicate with one another through this part of the brain that I've mentioned called the corpus callosum. And it also serves as a conduit, I guess you could say, by which certain sensory signals are transmitted from one side of the body to the other side of the brain, and also where motor control is affected as well. So back to our question about split brain syndrome. So I mentioned it's caused by lesioning and other means that sound like it would be intentional. And generally, the primary cause of split brain syndrome is intentional severing of the corpus callosum. And it might be done partially or it might be done completely. So it's been used as a last resort for people who have epilepsy, where they have violent seizures that spread from one side of the brain to the other. It's not a common approach at all to treating epilepsy, especially in the last century, because we see lots of different medications and other procedures that can treat epilepsy. But it still is periodically or very infrequently used. And so what it's doing is when they sever that corpus callosum, it seems to be preventing that seizure activity from going across to the other hemisphere. And so having that, going through the corpus callosum and actually severing it, or partially severing that corpus callosum, for many people can result in a great improvement in their quality of life. But when people have this done, they will often have symptoms that last for days or weeks. And for some people, the effects can be permanent. I think the fact that for many people, the effects are not permanent and they are able to overcome the effects is a testament to the brain's ability to be plastic, or what we would call neuroplasticity. It's a feature of the brain that allows the brain to form new connections, that allows it to compensate for injury, for example. So sometimes if someone also has a stroke in that area, that could cause split brain syndrome. So what are the symptoms of this? So imagine you don't have this corpus callosum that's promoting that communication between the right and left hemispheres. So when this happens, tasks that are involving both sides of the body are going to be affected. So things like walking and swimming and biking. And most people who have split brain syndrome will be fine with their memory and social skills, but for some people, it may be difficult for them to engage in those tasks in the same way, but they can overcome, many can overcome that very well. But for some people, what can be most difficult probably with split brain syndrome is that it can be difficult for them to learn to perform new tasks that require interdependent movement of each hand. So think about like learning to play the piano, where you have to use both hands, having them work together to create that desired movement. And so any task that involves the coordination of the right and left hemisphere is going to be affected, especially if there's an interdependent movement that's required. So someone who, for example, plays the guitar would be another individual, they would be affected as well. Now, there are some very unusual behaviors that you would see with some people who have split brain syndrome. And so this in particular seems to be involved in speech and object recognition. So let's say that a split brain person were to be blindfolded and then they were to be given an object to hold in their left hand. It would be difficult for that person to name the object because the information for the sense of touch is normally relayed from the left side of the body to the right, which typically has a weak language center. So without that intact corpus callosum, the person can't access verbal information in the left hemisphere as long as that object remains in the left hand. It seems that also another example for people who have split brain syndrome, if they were to have an odor that's presented in the right nostril, then it would be difficult for them to name the odor, but the left hand could point to the source. So this really shows you that interdependent nature of both hemispheres that we don't even think about as we move throughout our daily lives. I do want to point out, though, that some of these symptoms can improve over time, especially for younger people. Their brains have higher degrees of neuroplasticity. The older that a person is, the more difficult it is for them to overcome these any injury to the brain, whether it be intentional, like a person who intentionally had their corpus callosum severed when they were experiencing violent seizures, or if someone were to have a stroke, or someone were to have some other injury to the brain. Let's now take a look at some major regions or areas of the brain. We're going to start by looking at the forebrain. And so when we look at the overall brain, we see what we call the cerebral cortex. And the cerebral cortex is part of this forebrain, and it is divided into 4 major regions or lobes, and each hemisphere has 4 major regions or lobes. We have what's called the frontal lobe, then we have the parietal lobe, occipital lobe, and temporal lobe. So I want to start out by saying that most brain functions rely on many different regions across the entire brain working in conjunction, but each lobe that we're going to be talking about carries out the bulk of certain functions. Let's start with the frontal lobe. The frontal lobe is generally where higher executive functions, including emotional regulation, so when you're controlling your emotions, when you're upset or frustrated, and you're able to maintain a calm composure, your frontal lobe is at work, planning, reasoning, and problem solving. Also, aspects of our personality originate here. If you read in your textbook, you'll come across a person named Phineas Gage, and he's probably the most famous case of frontal lobe dysfunction. And this happened because of an injury that he experienced in the middle 1800s when he was working on a railway. And he was using what's called a tamping iron to pack in gunpowder for blasting a tunnel through rock. And when his head was slightly turned, A mistaken strike sparked an explosion, and this forced the rod upwards into his left eye and out through his skull. Believe it or not, Phineas Gage survived. He was blinded in his left eye, and he had damage to a lot of his left temporal lobe. And after this accident, many people saw some very significant changes in Gage's personality. So before the accident, he was known to be very responsible, hardworking, an easygoing guy. But after the injury, he became very difficult. He used a lot of profanity, disrespectful. He had a lot of trouble carrying out plans. And so we could see then, since he had this damage to the frontal lobe, why that would happen. Now, I would caution you, and I would say this is an example of one individual. We can't say that the only reason he experienced those changes was because of the physical injury to his brain. We know that many changes were a result of that, but there were probably also some life changes that resulted in that, and perhaps pain and other factors. And so we would use this as an example of a case study you learned about in the last chapter. And case studies are great in providing us with in-depth, detailed information. But we also need to keep in mind that it can be difficult to generalize the findings. So if we look at this image, we'll see that this is a picture of Phineas Gage. And as we've talked about, Phineas Gage suffered injury in part to his frontal lobe, in particular to the prefrontal cortex, which is an area of the frontal lobe that is involved in higher level processing, specifically in concentration and in emotions and other specific functions. Also, you'll note here that there's another important part of the brain that you should know, and that's Broca's area. So Broca's area is the area of the brain that plays a significant role in language production. So the main task of this area is to generate meaningful language so that the person can speak sensibly and fluently. This area of the brain was discovered in around the 1850s when a French neurosurgeon, Paul Broca, was examining the brains of patients who had had language difficulties. As we move on and we look more at the cerebral cortex, we're going to be looking now at the motor cortex. And the motor cortex is important in planning and coordinating movement. And if you'll note, as you look at this image, you'll see the orangish yellow band that's on the cerebral cortex. That is the motor cortex. And what you'll see is you'll see different body parts that are laid out on this motor cortex. And what you're seeing also is a proportional representation of the amount of brain space that's dedicated to each part of that individual body. So our body has about this much space, what you see here, dedicated to each part of the body. So when you look, for example, at the hand, you see a lot of space dedicated to the hand, considering how small the hand is when we compare it to, say, the leg. Although there's about the same amount of space dedicated to the leg, look at the disproportional representation of space. The leg is much larger, but yet we see about the same amount of space dedicated to it. So I would ask you to pause the video for a moment and to think about why this is. Why do you think there would be this relationship that we see here between the amount of space on the motor cortex and that particular part of the body? So the relationship has to do with the ability of that body part to engage in fine motor skills and lots of different motor abilities and activities. So when we think about our hands, think about the complex activities that you're able to do with your hands. Think about texting and typing, all of those small movements that you can engage in. So the more varied those movements, the more complex those movements of that particular body part, the more complexity that body part is capable of, the more brain space you're going to see dedicated to it. You'll also remember I described for you how the right side of the brain controls the left side of the body, the left side of the brain controls the right side of the body, and this is known as contralateral control. Let's now move on to the parietal lobe. The parietal lobe, again, is one of the four main lobes or regions of the cerebral cortex, and it's positioned, each of these lobes is positioned behind the frontal lobes. And the parietal lobe has some very specific functions that are involved in receiving and processing sensory information from all over the body. So we can see here something called the somatosensory cortex. And it's a very interesting image here that we see because it provides for us a similar representation as the other image did of the motor cortex. And what you'll note is the same type of relationship, except it involves senses instead of movement. So here we see a lot of space, proportionally speaking, dedicated to the hand, dedicated to the foot, when compared to, say, the trunk of the body. So when we think about why this would be, it makes logical sense that it would be because those particular areas of the body are much more sensitive. So the more sensitive that part of the body is, the more brain space we're going to see dedicated to it. So we're going to see a similar type of relationship here as we saw with the motor cortex. And so it's topographically organized. And again, just like the other part of the brain that we just talked about, the motor cortex, there's contralateral control. So it is the sensory cortex, the somatosensory cortex is providing that contralateral control where the right side is receiving information from the left side of the body and the left side is receiving information from the right side of the body. So we're still looking at the cerebral cortex, and we are now moving on to the temporal lobe. And the temporal lobe has many different responsibilities. I'd like to touch on a couple before I get into the one that you may read the most about or have heard about before. And so the temporal lobe is actually largely responsible for creating and preserving both conscious and long-term memory. It's important in visual and sound processing. It's important for language recognition. And if you'll notice, much of these abilities involve hearing and listening. And so the auditory cortex is part of the temporal lobe, and it's responsible for processing auditory information. And in particular, there's an area of this part of the brain that's called Wernike's area, and it's responsible for speech comprehension. That's its primary responsibility. Overall, I think it's very interesting too to point out that the temporal lobe, it contains some centers also for emotion, which would help us to understand why it is that when we listen to music, it can bring on certain feelings and how easily we associate music with certain emotional experiences. So you may hear a song, it reminds you of a person, or if you're out shopping and you hear Christmas music, it might make you feel a certain way, which of course is the intent of the person who, or that store, whatever, as they're trying to get you to purchase things in their store. So there are those connections between listening, between, again, hearing and emotion, and then also memory. And then finally, we have the occipital lobe, whose primary function is visual processing. We're going to be exploring this part of the brain in a later module. So I just want you to know at this point that it's important for visual processing. When someone has problems with vision, of course, it's not something that we would say necessarily is only due to issues with their eyes. It could also be due to issues with their optic nerve, which is carrying information from their eyes, in particular from the retina to the occipital lobe of their brain. And again, we'll be exploring this later in the semester. Let's now spend some time exploring the limbic system. Have you ever wondered what part of the brain controls emotions? Well, while the entire central nervous system helps to control our emotions, activities in the limbic system, and as you learned just a little while ago, the autonomic nervous system, are especially influential to our overall emotional health. So we're going to be looking at some important parts of the limbic system that are known as the amygdala, the hippocampus, and the hypothalamus, and what their responsibilities are. So, of all of the areas of the brain, the limbic system is said to be one of the oldest and most primitive if we were to look back at human history. And so it's thought that it has formed many, or that it formed many hundreds of thousands of years ago. And in fact, similar systems are also found in other animals, and this even includes reptiles. So in the past, the limbic system was even sometimes referred to as the paleo-mammalian brain. You may have heard that phrase before. I think what you should take away from your understanding of the limbic system is that it plays a very important role in both emotion and memory. So while the limbic system is comprised of more than these three structures that we're going to be looking at, we're going to spend time focusing on these. And I want you to be sure to know what the function of each of these are. You should also keep in mind that although we might talk about a part of the brain and its function, that doesn't mean that this is the only part of the brain that has that particular function. So before we look at each of those individual structures, the amygdala, the hypothalamus, and the hippocampus, I want you to note that some of the specific limbic system functions include controlling emotions like anger and fear, regulating eating, hunger, and thirst, responding to pain and pleasure, controlling functioning of the autonomic nervous system. And you'll remember earlier, as we looked at the autonomic nervous system, this is an important part of our nervous system that plays a role, or plays a significant role, in our sympathetic nervous system response. It's responsible for that response. And so it's important for regulating things like our blood pressure, our pulse, our breathing, and our arousal, especially when we're feeling threatened. So remember that fight or flight response. So that's where we see the importance of the limbic system. Also, it plays an important role in controlling aggressive or violent behavior and responding to sensory information, especially the sense of smell. Now, I want to point out, though, that when I say controlling emotions, or like anger or fear, or behaviors like aggression or violence, that does not mean that there's higher level processing happening here. We're talking about very primitive types of responses. It's our prefrontal cortex, our frontal lobe, that are responsible for those higher level processes. And this would make sense then if we think about, let's say, your cat or your dog and they're feeling threatened. You'll notice that even if you're, let's say, right with your cat, maybe you're holding your cat and you're outside in the yard and there's some other animal there, even if you're holding your cat and you are the one that your cat trusts and spends lots of time with, when your cat is threatened and sees that other animal, your cat might claw you, scratch you, get very upset. They're relying very heavily on their amygdala. Now, as a human, especially as you move into adulthood, you have much more rational responses because you are not relying so heavily on the amygdala. Throughout childhood and into adolescence and into adulthood, our prefrontal cortex, our frontal lobe, develops. It continues to develop. And so this then helps to mediate those types of responses so that we can have more rational, logical responses when we are experiencing something scary. So for your cat, for example, they don't have the well-developed prefrontal cortex or frontal lobe like you do. And so we both feel fear. The cat feels fear. I feel fear as a human being sometimes. But the difference is that although we are initially both relying on the amygdala to help us to have that sort of primitive response, to do what we need to do to protect ourselves, the cat doesn't have that prefrontal cortex that's well developed like you or I do, or that frontal lobe that's well developed. So our response can be much more rational and logical. So let's look at each of these structures individually. If we look at the amygdala plays a very important role in helping to helping us to deal with that fearful experience that we're having. It plays a very important role in fear and anxious emotions. And as I mentioned earlier, as we explore the sympathetic nervous system, the sympathetic nervous system is playing that vital role of helping to prepare us to fight or to flee. And it's the limbic system that is providing those hormonal responses that are going to be helping us to manage that fearful experience. So it's all of this is interconnected. And then we also see the hippocampus, and this is a part of the brain that we generally associate with memory. It also plays an important role in emotion. But let's look at this in a little bit more depth. So as we look at the hippocampus, it plays an important role in forming short and long-term memories through consolidating information. It also plays an important role in spatial memory. So being able to, for example, remember where things are in your neighborhood. So you know you have a memory for where your neighbor's house, or let's say you have a neighbor that lives maybe a few houses away. You have an ability to remember about where that house is and how to get there. It also plays an important role in tying together smells with specific memories. So think about when you smell something, how easily that can bring up memories of a particular event. Maybe you smell cinnamon or some sort of pumpkin spice during the holidays, and very quickly it causes you to remember the holidays that you've maybe had with family members or friends. And also, you'll note too that when you make those connections, you're also having an emotional response. You may have a good feeling, or it may be a bad feeling, but this has to do with that connection that the hippocampus has between memory and emotions, and also because of the proximity of the amygdala to the hippocampus, and that it's all part of this system, the limbic system. And if we think about how this is a part of the brain that is actually a very primitive part of the brain, it makes sense that as humans, we would have these very close ties between emotion and memory, and smell and memory. So for humans, it would be very adaptive in our human history to recognize, to smell something, and then very quickly have an association with that, between that smell and particular emotions like fear. Because if, let's say, that smell, whatever it is that we're smelling, is something that's a threat, then if we have that feeling of fear, we're going to be prepared. And we don't have to really think through that particular stimulus that's in front of us. We don't have to think to ourselves, how am I going to manage this? Instead, our body is automatically making those connections, which is going to be important for survival. So the hypothalamus, it's actually a very small part of the brain, but it plays a very crucial role in some very important functions. And this includes releasing certain hormones, regulating body temperature, maintaining daily physiological cycles, also controlling appetite, and regulating emotional responses. I want to go back for a moment to reflect on controlling appetite. It's interesting to note that if you were to lesion or destroy experimentally, let's say in a rat, a particular part of the hypothalamus known as the ventral medial hypothalamus, and it's called that because of its location. And I'm not going to ask you this on a test, but I do just want to point this out. If you were to lesion this, you would find that the rat would have an unregulated control of its eating behavior. So that rat would just continue to eat and eat and eat, regardless of the fact that the rat has eaten enough. On the other hand, though, if you were to lesion a part of the hypothalamus that's known as the lateral medial hypothalamus, also called that because of its location on the hypothalamus, you'd find that the rat's appetite would go way down and it would literally starve itself to death. So this tells us that it's not that the hypothalamus just has this one general function of regulating appetite. This should tell you that the hypothalamus is very complex, and what I'm describing is just the beginning. but we can see here that one part, if it's lesioned, leads to overeating. Another part, if it's lesioned, leads to a decrease in appetite. And so you could imagine then if someone were to suffer a stroke, let's say, on the ventral medial hypothalamus, that individual is likely going to have trouble controlling their appetite. You might find them overeating, eating a lot more than usual. And I want to point out too that when someone has problems regulating their appetite, maybe they're eating a lot more than they need to, or they're not eating enough at all, it's very unlikely that it's due to something going on with the hypothalamus. It's typically due to other reasons. And we'll be looking at that when we explore the motivation and emotion chapter. But that can be a cause if someone has had some sort of injury like stroke to that part of the brain. So as we've looked at the limbic system, you can imagine then what might happen if there was some sort of disorder in the limbic system or damage to the limbic system, that the particular experience that that individual would have could be very serious. So sometimes when people have damage to the limbic system, you might see things overall like disinhibited behavior, meaning that the person doesn't consider the risk of behaviors, ignores social conventions and rules. Now, keep in mind that if a person has damage to the frontal lobe or prefrontal cortex, we can also see this as well. We might also see increased anger and violence. And this is, again, this could be commonly tied to which part of the limbic system do you think? The hippocampus, hypothalamus, or amygdala? Well, it's typically tied to the amygdala. You might also find that a person may experience hyperarousal. And so what this means is that the person may have increased fear and anxiety. And so, for example, we might think of anxiety disorders. And sometimes anxiety disorders can be treated with drugs that are targeting areas of the amygdala to decrease fear-based emotions. You might also find hypoarousal, hypo meaning under. So the person may have low energy or a lack of drive and motivation. The hypothalamus plays, as you could see as I was describing some of its major functions, a very important role in motivation. So damage to this area could affect overall motivation. A person with damage to the limbic system might also have trouble forming memories. So ask yourself, which of these structures would most likely be tied to that? Well, the hippocampus. Now, the amygdala does play some role in memory, but the hippocampus plays a very important role in the formation of short and long-term memories. So let's imagine that you were to, let's say, you work in a nursing home and you meet a new patient, and that patient has had a stroke that has affected the hippocampus. Ask yourself, if you were to meet that patient, let's say today, and then you saw them again tomorrow, what do you think that person's response would be as you say hello to them? Would they say something like, "I'm hungry, I want to eat"? Would they say, "Do I know you"? Would they say, "I'm really upset and I don't know why"? Most likely they would say, "Do I know you?" Because the hippocampus plays a very important role in the formation of memories. I'd also like to point out that when we move into the chapter on human development, we'll be talking a little bit about Alzheimer's disease. We'll also be exploring this in the chapter on memory. And research shows that people with Alzheimer's and memory loss usually have experienced damage to the hippocampus. And this causes not only memory loss, of course, but also some disorientation and changes in mood. A very famous case study that we can tie to the hippocampus is that of patient HM, also an individual known as Henry Molaison. And in 1953, time basically stopped for patient HM. See, for roughly about 10 years, the 27-year-old had suffered from severe seizures, and by 1953, they were so debilitating that he could no longer hold down his own job. And so in 1953, HM allowed surgeons to remove just a thumb-sized section of tissue from each side of his brain. And this was an experimental procedure that he and his surgeons had hoped would quell the seizures that were so affecting his brain. Well, this treatment or this surgery worked. The seizures were abated, they were gone, but afterwards, HM was left with permanent amnesia. He could remember some things like scenes from his childhood, but he could also remember some facts about his parents and some historical events that happened before his surgery, but he was not able to form new memories. If he met someone who then left the room, within minutes, he had no recollection of the person or their meeting. So this was clearly a tragedy for HM, but it was also one of the most significant turning points in the 20th century study of the brain, where the understanding that complex functions like learning and memory are tied to discrete regions of the brain. It was through additional case studies and examinations of patients who had similar symptoms that researchers were able to conclude that that part of the brain plays a very significant role in the ability to transfer our perceptions and awareness into memories that can last a lifetime. Another important structure of the brain that you should know about is the thalamus. And the thalamus is located in the center of the brain, and it's involved in many different cognitive functions. And as you'll note here, it plays an important role in sending information to the correct lobes of the cortex for processing. So what it's doing is it's serving as a central hub to relay sensory information to the brain. It also plays a role in regulating sleep and consciousness, and it plays a role in the regulation of anger and aggression. So like most areas of the brain, the thalamus is multifunctional, and it's handling a number of different cognitive processes. Probably most known for, though, being that relay station of the brain, almost like a switchboard operator. Let's now spend a little bit of time looking at another part of your brain that's called the midbrain. And if you'll look at this image, you'll see that is just above the brainstem. As we look at the midbrain, the first thing we see here on this slide is the reticular formation. Some of you may have wondered which part of the brain is responsible for keeping a person awake or regulating the level of consciousness. And we'll be exploring this in a later chapter, actually in chapter 4. But the answer to this question lies in the reticular formation. So the reticular formation is a network of neurons and nerve fibers that are present in this part of the brain, in the midbrain. So first, let's look at its important role in having an impact or regulating our level of consciousness. So our level of consciousness and arousal are controlled by the reticular formation. There are pathways that go from the reticular formation to other parts of the brain that are telling your brain to wake up. So they're projecting information. Your reticular formation is projecting information to different parts of your cerebral cortex. And this then causes you, if you're asleep, for example, to wake up. It's actually considered that the state of consciousness is dependent on the continuous projection of sensory information to the cortex. So different degrees of wakefulness also depend on the degree of activity of the reticular formation. So what's the significance of this then? Well, let's imagine that there's an abnormality of this reticular system. A person might, for example, have narcolepsy. You're going to be learning about this in the next module or chapter. And narcolepsy, as many of you know, it's a sleep disorder that causes excess sleep, daytime sleep, sleep paralysis, and even hallucinations. And it can cause partial or complete loss of muscle tone that's associated with some emotions. And as you'll learn in the next module, this is called cataplexy. Well, injury or damage to the reticular formation is considered to be a major cause of narcolepsy and cataplexy. Another effect of damage to the reticular formation can be loss of consciousness. And it's actually been shown in experimental animal studies that damage to the reticular formation can cause persistent unconsciousness. And lesions to the reticular formation in humans can result in a loss of consciousness and even coma. And it's been considered that the loss of consciousness in epilepsy may actually be due to the inhibition of activity of the reticular formation. I should note that the reticular formation has additional responsibilities. For purposes of this class, I want you to focus on consciousness and arousal, but I do want to point out too that it does play a role in the regulation of the activity of skeletal muscles. It also plays a role in the control of muscle tone and balance. It also does play a role in the control of respiratory muscles and even facial expressions and some sensations that we have. But for purposes of this class, I want you to make sure that you know that it plays a very important role in consciousness and arousal. Another part of the midbrain is the substantia nigra, and it's a very small part of the brain, but it is a very important structure in our brains, and it plays an important role in the regulation of movements. The brain lesions that affect the substantia nigra can cause a number of movement disorders, including Parkinson's disease and other movement-related diseases. It's also thought to be clinically significant in the development of schizophrenia, which we'll be looking at that disorder later on this semester when we get into the module on psychological disorders. So I think the one you could most easily think about, or the disorder that can result from damage to the substantia nigra, is Parkinson's disease. And this happens because there's a degeneration of neurons in this part of the brain, in particular a part of the substantia nigra. And because of this, a person may experience tremors. Remember, for many of you who are familiar with Parkinson's disease, you may know that tremors involve a person who is it's an uncontrollable rhythmic movement of one part or a limb of your body. A person with Parkinson's might also have rigidity. And this is with a person who has Parkinson's disease, it's when a person has a resistance to passive movements. And if a person doesn't have tremors, they might have what's called plastic rigidity. And this person might have stiffness in their neck, and their trunk, and their shoulders. Their posture would be affected, where their body is bent forward, their thumbs might be turned into their palms. So here what we're seeing is the regulation of movements being affected. And that is what the substantia nigra plays a very important role in. Let's now spend some time exploring the hindbrain. The hindbrain carries out several very important functions. It's a fundamental part of the brain for information to go through, and its neurons play a part in the processing of sensory information. Its neurons also contribute to voluntary movement control, and they help to regulate the autonomic nervous system. If you'll remember, the autonomic nervous system is a division of the peripheral nervous system, and the autonomic nervous system has within it both the sympathetic and parasympathetic nervous systems. Remember, the sympathetic is important for that fight or flight response, and the parasympathetic is important for homeostasis. If you're having trouble remembering the sympathetic and parasympathetic nervous systems or the autonomic nervous system, be sure to go back in your book or go back into earlier parts of this video and review that. In terms of the hindbrain, I want you to be sure to know about some particular structures. So let's take a look at each of these. The medulla plays a significant role in helping to regulate processes like breathing, heart rate, and digestion. So if I were to ask you on the test a question like, Victor suffers a gunshot wound to the medulla, what would you expect to happen? The correct answer would be Victor would most likely die. And that's because of that critical role that the medulla plays in regulating those processes, including breathing, heart rate, and digestion. But most importantly, of course, breathing and heart rate when we're thinking about life and death. Also in the midbrain is the pons. The pons plays a key role in regulating breathing. So it has an integral role in the autonomic regulation of breathing. So this includes, for example, how much air you breathe in and how soon you take another breath. So it's up to the pons to ensure that you get enough oxygen no matter what your activity level is. Some aspects of regulating our sleep and wake cycles, again, that we'll be looking at in the next chapter occur in the pons, in particular during deep sleep. And so the pons plays an important role in regulating our sleep-wake cycle. So some people who have injuries to the pons might require medication to help them to regulate their sleep-wake cycles because of how the pons affects these sleep-wake cycles. The pons also allows for both the right and left hemispheres of the brain to exchange information about the senses. And this includes information about sensory input and function. So this could include, for example, hearing and taste and balance. So if a person has injury to the pons, this could affect sensory function and movement. So as we think about the pons, there are many different events that could lead to problems with the pons or injuries. This could include a brain tumor. Somebody could have a traumatic brain injury, a brain hemorrhage. And when someone has this sort of injury or this effect on their pons, a person then could have, as you could imagine, based on what you've just learned, they may have impairments that are related to their sensory function, breathing, sleep-wake cycles, motor function. And for some people, if they have damage to the pons, they might develop something called locked-in syndrome. And this is where a person has no sensory or motor function, but they have the ability to move their eyes up and down. And some people can blink, but the higher functioning of their brain continues. So they're cognitively intact and aware of their surroundings. So what have you learned so far in this module about the brain? Well, you've learned about lateralization. You also learned about the corpus callosum. You also learned about split brain surgery and the effects of this, which helped you to think about the important role of the corpus callosum. You also learned about the four brain structures and their functions. You learned about the frontal lobe, and you learned about a very famous case study on Phineas Gage. You learned about the prefrontal cortex and Broca's area and its role in the production of speech. You also learned about the motor cortex and its role in movement. You learned about the parietal lobe and the somatosensory cortex. You learned about the temporal lobe and Wernike's area and the auditory cortex. You also learned about the occipital lobe and its role in visual processing. You learned about the limbic system, including the amygdala, the hippocampus, and the hypothalamus, and you learned about patient HM and the hippocampus. You learned about the role that the thalamus plays as being the relay station of the brain. And then you learned about the midbrain, including parts like the reticular formation and substantia nigra. And then you learned about the hindbrain, including the medulla, the pons, and the cerebellum. So what will you be learning about next? Well, in our next module video, you're going to be learning about the CT scan, the PET scan. You'll learn about MRIs and fMRIs and EEGs. So you're going to be learning about brain imaging. So how can we get a picture of what's taking place in the brain? I'll look forward to seeing you in our next video.